Tonight we're going to do side effects survival guide. I'll explain what's common, what's rare, how to prevent, and what to tell your doctor. If anything I say fits your experience, take a seat. Listen for a little bit. It's good information and fun to listen to. So, number one side effect that most people complain about. If they're going to complain, they're going to complain about nausea. Some of it is in the head, self-induced. They expected nausea, so they brought nausea on themselves. But nausea is the most common early side effect, but it's manageable. Why does it happen? GLP drugs slow the stomach emptying. They're changing the output signal. The same action that reduces appetite can make your stomach feel full. You've got all those juices in there just turning and making your stomach just feel icky. But they're not leaving because that process is slowed down. So your stomach sends a signal to your brain that says, ew, ew, come on, man, ew. And your brain says, okay, dude, nausea, and sends the signal everywhere else. And that's why you get nausea. One easy peasy thing to do: smell an alcohol wipe. Waft it in front of your nose. It breaks those chemoreceptors that cause nausea. Now, it just breaks them for a minute or two, for a second or two. In some people, it's a minute. In some people, it's a second. In some people, it doesn't work at all. But hopefully it works for you long enough to get a drink of a protein shake, a bite of food, something going down your stomach so that you can get something to absorb those stomach acids. That's what you need. Ozempic and Wegovy are more likely to cause nausea, constipation, vomiting, in some cases, yes. So the nausea will usually show up the first days while dosing. Many people improve after a few weeks on the dose as the body adjusts. So your nausea will go away. Tough it out. Use those alcohol wipes. Get something in your tummy. It's a new hunger cue. You can do this. A little bit of nausea versus the side effects of obesity. Which one outweighs the other? You can prevent nausea by titrating slowly, make sure that your doctor takes you up slowly. A lot of doctors want to follow what's in the manufacturer's guidelines, what they did in the studies. And the reason they did that in the studies, they pounded people to titrate up really quickly, was because of the shareholders. They wanted information fast. They didn't give patients a choice. They just pounded them up. Every 4 weeks, change your dose. Every 4 weeks, change your dose. They didn't care if they were nauseated. They didn't care if they were constipated. They treated the nausea, they treated the constipation, paid them money. Keep going, dude. But now we're in the real world. Stay on the lowest effective dose for you. Talk to your doctor. Make sure that you don't titrate up so quickly now. Eat small, frequent bites, not huge meals. We no longer need 3 squares a day. Eat 6 smalls a day. Eat 9 smalls a day. Whatever you need. Whatever your tummy needs. And always go protein first. Avoid greasy, fatty, highly spiced foods. They'll turn that nausea up a notch for most people. Make sure any drinks that you're drinking, whether it be your morning coffee, your water that you need to get in, your protein shakes, whatever it is, make sure that you sip. Don't gulp. That's for 2 reasons. You want to not get air into your tummy. And also sipping is better. It will coat your mouth and your esophagus as it goes down. You get very dry mouth on these meds. And remember to drink fluids in between your meals. It's hard if you drink and eat at the same time. You'll get way too full too fast. And don't forget Grandma's remedies. Ginger and peppermint. Anything ginger or peppermint helps soothe nausea for many, many people. So what do you do if nausea is a little more than just a little nausea? What if it's more moderate nausea? You can try an oral anti-nausea strategy first. You can ask your doctor for something. You can ask them for Zofran or any other over-the-counter medication. You can ask them for a prescription. Ask them what works for nausea. But remember, most of those anti-nausea meds are going to increase constipation, And we're going to talk about constipation later. So be sure you're drinking water, water, water if you're taking anything for anti-nausea. So how about when to go to the hospital? If you honestly can't keep fluids down for 48 hours, if you are losing weight too quickly, if you are getting dizzy and faint, go to the urgent care. See what they can do for you. They might be able to give you a bag of fluids. They might be able to give you more oral medications and hopefully get you over that hump of nausea. Hi, Cindy. Welcome in. The next one. We always talk about poop. Constipation or diarrhea. Poop changes are confusing. Some people get constipated, other people get diarrhea. Both can be common. GLP meds change gut motility, so bowel habits will shift. The FDA labels list constipation and diarrhea among the most common side effect. So the simple fixes: hydrate, hydrate, hydrate. Get that water in. Add soluble fiber like oats and psyllium husk. For diarrhea, reduce high soluble fiber. Prioritize binding foods like bananas and toast. Hi, Nursty. You can use stool softeners or osmotic laxatives. For constipation that's not fixed by water and fiber, many clinicians will recommend a short trial of Miralax or a stool softener. But be sure to ask your provider if those are okay for you. Another thing that helps with constipation, get out there and walk. After supper, walk, walk, walk. When to call the clinician. If it is severe or persistent diarrhea causing dehydration or constipation with severe abdominal pain, call your practitioner. Possible bowel obstruction signs would be not going to the bathroom or diarrhea that's coming around a constipation area. Constipation can become a surgical event. Diarrhea does not become surgical. You may need a bag of IV fluids, but it's not surgical. So make sure that you hydrate, hydrate, hydrate. You do not want constipation. You do not want surgery. So how about reflux and slow gastric emptying? These meds slow the stomach. That's part of how they work. That's the mechanism of the medications. That's what you want them to do. So you don't want to take something else that aids in digestion, that speeds up digestion. Why would you even take the meds then? Because you're counteracting what the meds do. So don't take anything that aids in digestion or speeds up digestion. Just leave it. You want something that does not aid in digestion. Papaya enzymes, yay! So yes, they slow the digestion, they slow the stomach emptying, and yes, that can cause problems. GLPs commonly delay gastric emptying. They may worsen reflux, and of course, they cause a feeling of fullness. And if you can eat through your hunger cue, it can be a severe feeling of fullness. So what you need to know in plain language: most people have temporary symptoms. Bloating, belching, a little bit of reflux, but they pass. They should pass in the first couple weeks. A small number of people report longer term belching, reflux, and that extra full feeling from food, where that food just is not moving. If someone has a history of slowed gastric emptying or gastroparesis, they really want to talk with their provider before going on these meds. Because these medications cause a temporary gastroparesis. When you go off the medications, the medically induced gastroparesis stops, and when you go back on the medication, the medically induced gastroparesis starts again. But if they already have gastroparesis, it's not going to. All it's going to do is that gastroparesis that was there is going to remain the same. So how to lessen reflux and fullness? Be sure that you are eating small portions. Avoid laying down for 2 to 3 hours after eating. It's best to walk after eating. Don't drink caffeine, drink water. And it's best to stay upright. Sit, walk, stand, and drink water, water, water. If reflux is new, discuss acid reflux options with your provider. PPIs or H2 blockers can be very helpful if your reflux is new. So when does it become an emergency? If you have constant abdominal pain or vomiting that just won't stop, the inability to pass gas or stool, that could be a bowel obstruction. You go to the ER. It's been reported rarely, but it does need evaluation by your doctor. All right, the pancreas and gallbladder. Hi, Nana. Hi, Alpha. There have been reports of pancreatitis and gallbladder problems, though not common, but of course we watch for them. The FDA labels and clinical support list pancreatitis as a reported adverse event, and regulators have investigated case reports. News coverage has highlighted clusters of reports and ongoing investigations. What does pancreatitis feel like in layman's terms, though? Pancreatitis is the most severe abdominal pain you have ever had. Worse than childbirth, worse than gas, worse than anything you have ever had. When patients walk into the ER bent over, can't walk, that looks like a pancreatitis. The pain usually radiates to the back. They have nausea, vomiting, and high fevers. If you get severe abdominal pain, if you get any abdominal pain that lasts any length of time, you call your provider or go to the emergency room or an urgent care. And just make sure that you tell them, I am on a GLP and I have abdominal pain. So gallbladder. Any rapid weight loss is going to affect the gallbladder. It is not the medication, it is the weight loss. Rapid weight loss can increase gallstones and increase inflammation in the gallbladder. If you have right upper quadrant pain, fever, or if you're jaundice in the eyes, go to the ER. And believe me, you'll notice the jaundice in the eyes. It's almost comical how it looks. It doesn't look real. When you see someone that's jaundice in the eyes, it's like, what's that from? What's wrong with your eyes? What'd you do? Are you pulling a prank on me? And you can't say those things. But you say them in your head. The whites turn very, very yellow. It is a bright neon yellow. Very yellow. I will show you after the talk some pictures of jaundice eyes. It is spooky yellow, yes. So what do you do to be proactive about the gallbladder? You keep your prescriber informed of persistent GI pain. If you have a history of pancreatitis or any gallbladder disease, you discuss alternative options with your clinician before even starting. Because if you are an alcoholic, if you are someone who eats a lot of fatty meals with red meat, your pancreas might already be damaged. So just let your provider know, and they'll take care of you. So hypoglycemia. Let's talk about hypoglycemia. If you are taking insulin or any other sulfonylureas, I can never say that word, GLP meds may raise your risk of low blood sugars. Let me repeat that. If you are taking insulin or sulfonylureas, GLP meds may raise your risk of low blood sugars. They don't do it alone. They only do it if there is another medication on board. Okay? GLP-1 receptor agonists alone do not cause hypoglycemia in people without diabetes. But when combined with insulin or insulin sulfonylureas, we'll say, the risk goes up. Both Mounjaro and Zepbound labels warn against increased hypoglycemia risks and advise dose adjustments. Me neither. So practical rules say if you're on insulin, call your prescriber before starting the GLP to discuss dose reductions and monitoring plans. Check your blood sugar more often or wear a CGM. Keep quick sugar sources handy like juice and glucotabs, and know hypoglycemia signs like sweating, shaking, and confusion. Yeah, it's kind of weird. If you have very low readings or severe symptoms, follow your hypoglycemia emergency protocols. If you combine insulin and GLPs, it's not good news. It takes your blood sugars out of whack. What am I losing? Thyroid C cells in rats. There's an important warning in some labels about thyroid C cell tumors in rats. So some GLP medications, not all, carry a boxed warning about thyroid C cell tumors because rodent studies showed these tumors. It is unknown whether humans are at risk, but the label advises not to use the drug in people with personal or family history of medullary thyroid cancer. Not papillary thyroid cancer, medullary thyroid cancer. No, I'm not talking to Alan. He's downstairs. So it's not the papillary thyroid cancer. It's not the common one. It is medullary thyroid cancer. Medullary thyroid cancer is extremely rare. Only 0.03% of the continental USA have it. That's low. So what to watch for? Neck lumps, swallowing problems, hoarseness. Report those to your doctor. Don't panic if you have a thyroid nodule. Thyroid nodules are actually very common. They say most Americans have thyroid nodules, and we just go about our lives with them, and they are asymptomatic, and we don't know about them until we have some sort of a CT that catches them on incidental findings. Injection site reactions. We all know this one. Other things people ask. The injection site stings and gets a little red. What's normal and when to worry? Okay. That'd be okay. Minor injection site redness and soreness is common. Severe swelling, spreading of the redness to more than a quarter, breathing difficulty, anaphylaxis, those are not normal. If you get hives, face swelling, throat tightness, anything like that, go to the ER right away. So pro tips, make sure you're rotating your sites. Make sure you clean the site before you inject. Make sure you're pushing hard. And report persistent or severe reactions to your practitioner. So most side effects are GI and usually improve with slow titration, lowest effective dose for you. and mild lifestyle changes. Some rare but serious events have been reported, so know the emergency signs. If you're on insulin, be sure that you are checking your blood sugars often. So you can tell your practitioner something like, I started my GLP on August of 2022. My dose is 15 milligrams. I have persistent nausea and constipation, abdominal pain for 15 days now. What can we try? Slower titration, anti-nausea, or switching medications altogether. You can say, I'm on insulin. Should we preemptively lower my insulin or check my sugars more often and lower the GLP? If you're in the emergency room, you can say, I'm on Mounjaro and I have severe upper abdominal pain. I'm concerned about pancreatitis or bowel obstruction. Make them work. Make them feel your tummy. So just remember, most of the side effects, easy peasy, lemon squeezy. We are warriors. We can handle this. You've got these side effects. There is no side effect out there that is worse than the side effects of obesity, than the side effects of diabetes, than the side effects of obesity, than the side effects of diabetes, than the side effects of heart problems, of PCOS, of sleep apnea. This medication is more important than any side effect out there. Just remember that. When you're dealing with a side effect, think about, do you suck it up because it's more important than being obese? Or do you stop it and remain obese? Just remember that. And remember, we're here to support you. Scale victories, non-scale victories, any side effects that you have, we're here every night, 6 p.m. Central, on TikTok. Be there or be square. I'll be here. Will you? Any questions?